Welcome to the Faith and Mental Health Podcast, where two worlds collide. I am your host, DeAndrea Bolden. Join myself and others as we have relevant, engaging conversation on a variety of topics that are related to faith and mental health. So be sure to tune in weekly and also to subscribe. Did you know that you can listen to this podcast on all major podcast platforms, such as Apple, Google, and even Stitcher? You can even catch this podcast on my YouTube channel. As a listener, please know that we want to hear from you, and we hope that you would reach out with feedback, suggestions, and even ideas for guests and topics that you would like for us to include. Oh, do you mind helping me out by simply sharing this podcast with others? Thank you, and I hope you enjoy today's episode. God bless. My name is DeAndrea Bolden, and you are tuned in to the Faith and Mental Health Podcast. Today, I have an amazing guest. I'm so excited for you guys to get to hear from Dr. Cy or Dr. Soyini Powell. And so, you know my rule, I don't introduce people. I'll let them tell about themselves. And so, Dr. Powell, can you please introduce yourself to our listeners?
My pleasure. Yes, I'm Dr. Cy Powell, and I'm a board-certified OBGYN physician for about 38 years, working in conventional medicine here in the United States until recently. I went rogue, and I did so because not just because of COVID and all that craziness. I went rogue way before COVID because I got sick.
Wow.
And 10 years I struggled with 4 different chronic disease diagnoses, various injectables, pills, immunomodulators, because I had an autoimmune disease, hypertension, aortic stenosis, all this crazy stuff. And I wasn't getting better. And finally, I just said, something has to change. And I found integrative nutrition, became a certified nutrition health coach, and used everything that I learned as a coach to transform my life. Lost 50 pounds, came off every single medication that they had me on, and I have clarity. I have just energy because I changed my diet. I am gluten-free, dairy limited, and sugar limited, and I changed my lifestyle. So I get 7 hours of sleep every night. I make sure I live in a self-care mindset and not that toxic self-sacrifice I used to live in when I was working in OBGYN, 24-hour on call, complicated surgical cases, crazy stuff that really is part of the factoriness of healthcare in this country. It was always about how many patients can you see? How many procedures can you do? You know, it wasn't never about, is the patient getting better, doctor? Are you making patients healthy? Nobody ever asked me that. So because of my own being a wounded healer, my patients would see me and say, what are you doing, doc? You look 10 years younger. Every time I see you. And that's when I realized I need to be talking to my patients. Wow. And they were asking me questions like, why don't my other doctors talk to me like you talk to me, Dr. Powell? You know, I can't answer that, but what happened is that I ended up creating this radical wellness program as part of my GYN. And I now call it GYN Plus. Because you don't need to hear when you come to see me, when was your last mammogram? When was your last pap smear? Because those are not really prevention tools. They are early detection. And we need them. And I still ask you that, and we'll still do that. But I need to ask you additional questions. You know, what's in your diet? You know, that kind of thing. And patients love it when you listen to them, when you don't interrupt them within the first 15 minutes that they're talking to you. And I'm going to tell you, I used to be one of those doctors that believed that medicine solved all the problems until I got sick, and it didn't. And I realized that there was some significant problems with medicine. And then COVID came along and it has exposed, horrible breakdown in patient interaction with physicians, not being heard, not being listened to, actually even not being valued. And it is precisely the marginalized community, the Black and Brown people, that this is happening to even more so. I just attended a panel on screening for the movie called Aftershock, which deals with the problems of maternal mortality rate in the African American community, and not just the effect on losing mothers dying in childbirth, but leaving fathers and children to raise themselves and to take care of themselves.
I want to interject right there, because you definitely said a lot, and I want to go.
I know, I'm sorry.
No, you're good. You said a lot of good stuff. But there was a couple things I wanted to kind of backtrack on before we get into all that, because infant mortality rates, maternal mortality rates, and stillbirths, all those things are more prominent in African American women. But first, I want to go back and talk a little bit about the nutrition piece. The reason that's so important is because everybody may not be a mother, everybody may not even want to be a mother, but everybody has to eat.
Yeah,
that's very true. I think I applaud you, especially being a doctor that, you're an MD, so you went to an allopathic medical school. Yeah, that's your training. And I applaud you for taking the time, even in your own situation, and learning some new tools to better help and better manage your patients, because more and more people are wanting more integrative medical care. They're wanting a more holistic approach. They're wanting more preventative care. And so I want to talk a little bit about that diet piece, because a lot of Americans have poor diets. I mean, the things that are put before us all the time, you get the coupons for fast food. There's fast food restaurants everywhere. There's fried foods everywhere. And, it's nothing wrong with it. And I'm not indicting people. There's nothing wrong with, having something fried every now and then. However, as a doctor, I know that you would say that over time, eating like that all the time is good for no one.
It has been the number one issue. It's been the number one issue in this country, and it is my major focus. I didn't mean to segue into the maternal mortality, just something that I just recently did Thursday, so it was hot in my mind.
Oh no, we're going to get back to that.
Okay, but nutrition is the main key. But here's why: because health is a keystone piece in your life. It is the arc at the top of the arch. That's that keystone piece. And without the health, everything else that arch is supporting falls apart. Your finances, your parenting, your career, you can't do anything if your health is poor. Okay? So we really need, and here's one of my lovely statements that I love to say to my clients, is that you only have one body to live in. Take good care of it. That's the only place you have to live.
So true.
Yes. And nutrition science has now become a science. We now know so much more than we knew before about food as not just fuel to fuel us, to give us energy, but to nourish us, to give us nutrient support so that our bodies can function the way they are meant to function. And I'm going to tell you that modernization, the way we farm our foods, the way we farm our animals, the way the food industry puts all kinds of chemicals and preservatives. And if high fructose corn syrup, get rid of it, okay? It is the bane to most of the processed and refined foods that we have. And it is a problem with diabetes, obesity, heart disease, hypertension, okay? And I have 3 of those, okay? I had, no longer. Because I changed my diet. And that's what's critical here. And this is what I really want to say and get out there, is that the food industry, okay, and the big pharmaceutical industry, they don't want you to know that you really don't need them when it comes to chronic diseases. Because chronic diseases are caused by the food we eat and the chronic inflammation that comes from it, that's what's hurting us and causing all of those chronic diseases. And if you simply change your diet and lifestyle behaviors, you get better. I healed myself that way.
Wow.
Okay. So for ruptured ectopics, for hemorrhaging, bowel perforations, and accidents. We are good in conventional medicine in this country because we've got high tech, we got all the drugs, and we've got it. So if you are in that critical acute care setting, we're very good at that. We are not good at chronic diseases. What we do with chronic diseases, we say to you, oh, it's only 30% blocked. Come back. We'll see what you look like next 6 months from now. And once it gets to 50 or 60%, then I can put your stent in.
Wow.
That's what they do. Because medical school training for me, I'm an allopathically trained physician. I got 4 weeks of nutrition. That's it.
Wow.
Okay. And nothing about probiotics, prebiotics, nothing about the gut microbiome. All this is new knowledge.
Yes.
Okay.
Yes.
New knowledge that I've acquired because I was looking for answers to heal myself.
Mm-hmm.
Yeah. So
that's really, really, really good. I like how you started talking about gut health and stuff like that. That's things that I've been doing a lot of research with on my own, and looking into different things and trying to live a healthier lifestyle. And when you know more, you can do more. When you know better, you can do better. And I don't think you can emphasize enough how important diet and not living a sedentary lifestyle is.
Right. And it is true that to know more, you can do better. And people, and medicine thinks that too. Oh, just give them some information, just educate them, bring them in, have a talk. Patients need support,
yes,
guidance, and accountability. They need a vehicle to use to help them. They can't navigate it alone. They need help. Because what happens when you're learning to do, because my thing is not just diet, okay, and lifestyle changes, but part of diet, there's a balance of eating and not eating. So for me, diet includes fasting, intermittent fasting.
Yes.
We have forgotten to balance periods of eating with periods of not eating so that our body has time to repair, to heal, to turn over. We need to do that. The old beat up cells, that are not functioning so well. That's what happens when we're not eating, when we're sleeping, because we're in the fasted state sleeping, okay?
Isn't it 3 days, Dr. Powell, that it takes for a lot of those bad cells for the body to kind of get rid of them?
Yeah, it takes, usually that's called autophagy, where the body goes after the damaged cells. And the longer the fast is when that starts to kick in and happen. Yes.
Awesome.
So I would say anything 48 hours or more, you're getting into the autophagy, realm. And all you need to do, which is why it's called intermittent, is to do it repetitively and frequently, and that's how you get the benefit. You don't just fast once and say, okay, I fasted, I'm good. This has to become part of your life, okay? Your lifestyle. That's what I mean by lifestyle medicine. And we have to do this on a regular basis. There's a couple of, I have a nice little handout that I call the 10 easy peasy tips for weight loss. And I'll share that with anyone who's interested, because it's common sense and little things like that we don't get to hear because doctors are so much more into acute care, symptoms, and make the diagnosis, give the drug, or recommend surgery because we're so acute care focused, okay? And it really does help to, lost my train of thought. I was going to say that mostly diet and fasting are the tools to use. And though it seems like it's simple, it's easy to do, but it's also easy not to do. Here's what I was going to say. I was going to say that you start out, you're doing great, and all of a sudden, Uncle Bob calls you because he's got an emergency, or the kids have this. Life happens.
Right.
Okay. And it can throw you off. And it's very hard if you don't have someone to call and say, hey, I'm not going to do come on, girl, we can do this. Let's just do this. And then I'll help you, whatever. You get my drift. I'm saying that people need people. Doctors need to be engaged with the patients. And what I'm recommending, and what I call, what I want to do, GYN plus, because I know that I need to bring my patients in more than once a year for a 15-minute visit and say, how you doing? Come back and see me in a year. That's not preventive medicine, okay? So in addition to that, anybody who is seeking to lose weight, come off their medications, reverse their chronic diseases. They need frequent, low impact visits and interactions, weekly group coaching visits, so they can get the nutritional education, ask their questions, get the support, find out other ways of circumventing, their problems. What did you do when your stomach started rumbling after only, 11 hours and you had 4 more to go? What did you do? That kind of thing. And there are tips to help you get through, because what happens when you try it on your own, if it doesn't work, you say, oh, I tried that, it doesn't work. And that's what I get from most of my patients who say, oh yeah, I heard about that. And I tried it. I've tried everything, they say. No, you haven't. No, everything, that's kind of not, that's pervasive, and usually what builds in a kind of helplessness. I can't do, there's nothing I can do. So I'll just, and that's what I'm trying to plow through for patients, because medicine, I will have to make them allow me to have group visits, because that's something that is new. It's part of the workflow, is now in functional medicine circles, you see that more and more. And there are a lot of doctors that are concierge medicine. They're not even going through insurance companies, because insurance companies don't want to pay for counseling services, for behavior modification services,
Gotcha.
which is exactly what we need. It's a mindset issue.
Very true.
Yep. What we forget about in conventional medicine, I work with the triad. I call it balance to bloom, balancing mindset. I work in the intersection of food is medicine, mind-body connection, and anti-aging. There's a spot right in the middle there that includes diet, fasting, and lifestyle changes.
Wow. That is really, really good. I'm really enjoying this myself, because a lot of this stuff I had been researching, and even in grad school, some of this stuff I took the time to really delve into. So for me, this is exciting. So I hope that those that are listening, I hope you're excited, because sometimes the very thing we need isn't something that's going to make us super happy and feel goosebumps. Sometimes what we need is a better diet, to exercise, to get that education and have that support and get that discipline, so that we can live a healthier lifestyle. And so, Dr. Powell, I really thank you for, sharing this. The thing about it is, and I think I was talking to my husband or somebody, there's a lot of information out there. I read a lot of scholarly articles and peer-reviewed articles and stuff like that, but the average person wouldn't be able to go through all that material and all those charts and all those graphs and all those statistical analysis and all that stuff and blah, blah, blah. Right. And so a lot of the information is there, but it's not presented in a way the average person can understand it, is my point. There's a lot of information out there that can help a lot of people, but we need people like you that will break it down and dissect it and make it to where it's available to the average person, because sometimes what the medical community is saying, and sometimes some of the attitudes that come from professionals in that community, it's off-putting to average people.
Oh my goodness.
And when I say average, I'm not trying to diminish people that aren't in the medical community. I'm just saying people that don't have that academia and that experience.
No, and it's very, very true. And even people who do have that academia and that experience, sometimes it's work for me to navigate and to figure out what's sound and what's crazy, because there's all kinds of information. There's misinformation, there's polluted information,
very true, biased information.
Yeah, biased information. There's all kinds of stuff, and that's what you have to kind of work through. So that's what I do. That's why we now have patient advocates, we have doulas, we have all these different intermediaries to intercede, because I do not understand how the average everyday person can figure out. It took me 4 phone calls and 3 different times and reading a book just to sign up for my Medicare. Okay, now I'm a doc. I deal with insurance all the time. I know what Medicare, but I had to study it and figure that out, what was best for me, the best plan, because you already have 15,000 plans. But anyway, so navigating that sea of information and misinformation and all that kind of stuff, disinformation, is why I'm here. Okay.
That's
Because
good.
it is not easy. And my cousin, I've just recently had a lot of people in my family. I have a big family. My mother's the oldest of 10. She turns 91 this next Friday. And
Wow.
we're having a big glass for her. But so I have a big family. And my cousin says, you don't think you got that MD degree just for you, do you? So I'm the family doc. They call me when there's an issue, whether it's gynecology or not.
Right.
Okay. And I say, okay, tell me what's up. And I get on and I figure stuff out because
Right.
it is not obvious or easy. And I'll tell you, I was just at that maternal mortality screening of the movie Aftershock. And people in the audience, one of the young sisters came up to me afterwards, teary-eyed. She had a friend who she lost in childbirth. And she looked at me and she says, can I see you? Oh my God, she lifted me up. Yes.
Wow.
You're exactly why I'm here. I want to help you because here's how I help women. Get you healthy. So we don't have multiple comorbidities. We aren't the number one on the list for diabetes. We're not dying of heart disease.
Right.
Okay, because everybody thinks the number one killer for women is breast cancer. It is
It's
not.
heart disease.
It is heart disease.
Absolutely.
Yes. And we have certain special things that set us up for that. Being in the menopause, we lose the protection of estrogen. So now our risk goes back to that of what men are. So there's a lot of things: smoking, drinking, sedentary lifestyle, not getting enough sleep, not managing your stress well. I'm telling you, I was one of those too. In the high-powered type A person, you pick coping mechanisms that start to work initially, but over time they can become quite counterproductive. And that's anything from workaholism, sex, food, eating too much, drinking too much, smoke, whatever, drugs, whatever it is. These are mechanisms that people use who are stressed out trying to cope, as opposed to meditation, going for walks, mindfulness, things like that. So I'm bringing that back. I'm bringing the woo-woo back to Western medicine.
That's good. That's really good.
Yeah.
I even liked how you talked about mindfulness and meditation. It's so much, even the rest. I made a post on Facebook. I think it was yesterday. I reposted a doctor. There's several doctors that I follow, and I will share some of their contents. And the post was all about rest. And I was like, rest is something that's not valued in this lose sleep to secure the bag mindset, this grind and get out the mud. And it's like, I've told people, I said, what good is it to have all that if you're not going to have your health?
And this is what my husband said when I was burning myself. I was heading to burnout before I realized that I needed to change things. He said, when you have your heart attack and you pass out on the floor in the office, they'll step over you, take you to the emergency room, and then hire someone else to take over for you and do it and fill your shoes.
Yeah.
So if you do it, they will let you, is what my husband always said.
Right.
I had to learn to pull that back, and it was very difficult. And I ended up having COVID do it for me. I was planning on retiring in 3 to 5 years, and COVID said, it's time to go now.
Oh, wow. Okay.
And that's when I decided to really ramp up my coaching. And I have a private coaching groups. I coach one-on-one. I prefer the group because you get much more interaction and interplay with the group dynamics, and my clients love it. And I do that. And I also have a 21-day fasting challenge, because I really think people think, oh, it's just easy, just don't eat. It's a little harder than it.
Oh, yeah.
And I think having support and a little bit of guidance can get you through the sticky stuff so that you can really learn to put it in your life. And not everybody, some people have an easier time than others, but it is simple and it's easy not to do. So that's why you need not to think of it as, I have to do this by myself. It can be done in a group, and you'll get a lot more, and it's fun. You're working with like-minded women. Everyone's, got some great ideas, maybe some things you didn't even think about you could try. And it's that connection, it's that feeling like you're engaged that really makes you stick to your motivation and implement what you need to do to make yourself better.
That's good. That's really, really, really good. It's funny when you were talking about the the group coaching. There's a quote that I saw online, and it says, "If you want to go fast, go alone. But if you want to go far, go together." And that having that support and having a group and having people that are like-minded and having people that you can connect with and reach out to that are tangible, it makes a world of difference. It really does. In anything you're trying to do, we need support. We're humans. We need those connections.
Exactly.
And so I'm just excited. I love everything that I have heard. I am this kind of, listen, doctor, you don't know you don't know how much this thing got me excited. I'll probably be up on the internet tonight looking up articles. But listen, that's me. I'm a researcher.
Right.
And so but no, so we have a couple of minutes left. Okay. And what I want you to do is kind of let people know what to expect, because for those that don't know, I'm sorry, I forgot to mention this. I really did get excited. Dr. Soyini Powell, or Dr. Sai, is going to be one of the virtual speakers for the Faith and Mental Health Summit. And so I need you guys get registered and make sure you specifically register for her talk so that you can get email reminders of when it will be live. And so the schedule is on there. It lets you know whose talk will be live, what day and what time. But guess what? I'm always thinking of you guys. There will be replays, but I'll get to that later. And so Dr. Sai, just give people, we got about 5 minutes left. Share a little bit about what they can expect from your talk, and let people know how they can find you, how they can get in that group or get that coaching so you can help them with their mindset and their support and their accountability and things like that. And then we're going to go ahead and wrap it up.
Okay. So I have the program is called, it's called Balance to Bloom. That's my website, balancetobloom.com. And it's part of what I've set up for this year, GYN Plus, or what I call a year for radical wellness. And basically, it's like I said, it's a holistic approach to health and wellness using diet, fasting, and lifestyle medicine. I want to teach natural and sustainable strategies that will help women reclaim their health, release unwanted weight, reduce stress, and age optimally without the risk for dementia. And it is all about getting rid of the chronic inflammation from what you're putting in your body. So we are what we eat. So I've modified my GYN practice to include group coaching, and I call them health coaching cells, so that you should be able to go to your doctor once a week and be a part of a coaching cell, so that your group there for who are dealing with diabetes or heart disease or weight, you guys can work together. And that's what I'm trying to get medicine to open up and see. Now, right now it's a brick wall, but I'm getting little dribbles here and there. I'm getting through, and I'll be starting a GYN practice March 1st at a clinic through the Black Doctors Consortium here in Philadelphia. So that's my shot at getting what I know is needed to make it true preventive healthcare for women. And it is not just getting a mammogram once a year. That is only a minor part of it. It is learning how to take care of your body, only place you got to live, so that you can age optimally, you can maintain vibrant health. And it's just a few little tweaks to it. And it's not about toxic, noxious drugs. It's not about deprivation, feeling, here's what I don't want you to feel. I can't eat that. I can't eat pizza. Right. No, as opposed to, how about this? I don't eat pizza, or I'm not eating that today because I'm going to fast in a couple of days, and I'll eat that before I fast, because I know fasting will help clear that out of my system. So you don't want to feel deprived. Deprivation undoes any goal. So you don't have to have surgery. You don't have to take toxic drugs. You don't have to feel deprived, and you don't have to go back and forth, yo-yo dieting, trying all these, calorie restrictions, cutting out this, and then going to the doctor and finding out that, you lost a little weight initially, and then it plateaued, it stopped. And then you got mad, and you felt you backslide and went right back to your comfort zone. What you always did. That's what's been happening. And that doesn't have to happen if you understand that you just need to work with like-minded people, and I can help you, show you how to change your mindset so that you can regain control without paying big pharma and without having to go, bankrupt in your old age because you're paying for dialysis and you're paying for because your kidneys are shot because you're diabetic for the last 15 years, getting ever increasing different drugs. And that's, it's just abominable how we manage sickness in this country. And I want to shift us into a more active role that patients have to play. And I can show you how to do that.
Wow. This has been so enlightening and eye-opening, and I'm excited. And so for those that have been tuning in, you've been listening to Dr. Soyini Powell. She's going to be a guest, a virtual speaker for the Faith and Mental Health Conference. Her website, which I'm on right now, is balancetobloom.com. And if you go on her website, you can get a free ebook titled The 3 Mistakes You Make That Keep You Stressed Out, Sick, and Overweight. I would admonish you, health is an investment. You're going to invest in something. Either you're going to have to invest, when your health is gone, or you can, on the front side, invest in taking a hold of and preserving your health now. So connect with her, look out for her. This is a powerful woman with a powerful message. And so I want to thank you guys for tuning in. And like I always say, until next time, thank you.